Hi everyone, welcome to another segment of what you need to know about diseases. My name is Jessica and my co-presenter Adeze. Last week to talk about osmospherosis, and today we're going to be talking about Addison disease. Addison disease is when there is an insufficiency of the adrenal gland which sits in the kidney that includes partial or complete destruction of adrenal cell, which is due to the increase in the release of glucocortic and mineral corticols.
Now let's talk about the signs and symptoms of Addison disease. The effects of Addison disease include low blood pressure, low temperature, low weight, alopecia, which means hair loss, low mood, low energy, low glucose, low sodium, which leads to salt craving, anorexia, joint and muscle pain. In fact, everything low except the two high P's, the hyperpigmentation and hyperkalemia. In Addison disease, the ability to increase the cortisol production with stress can lead to an Addisonian crisis, which could lead to kidney failure, shock, super low blood pressure, low back pain, syncope.
Forward risks of this disease include cancer patient with compromised immune system or autoimmune condition such as gravel disease, type 1 diabetes, and chronic disease like tuberculosis. Addison disease is being diagnosed through blood tests to measure level of potassium, cortisol, and sodium in the body. Imaging tests such as CT, insulin-induced hypoglycemia tests. This test gives the doctor relevant data pertaining the hypothalamus, adrenal, and pituitary gland.
Addison could be treated with intravenous cortisol, prednisone, antibiotics, and patients should be monitored for fluid and electrolyte imbalances and hypoglycemia. We should also teach patients to avoid stress and strenuous activities. They should also avoid alcohol and caffeine and report any gastric bleeding. Most importantly, patients should not stop medication abruptly to avoid rebound. That is all we have for you on Addison disease this week. But before we go, let's briefly review what we just discussed. We have few questions for you. Number 1 question says, Addison's disease is A. Increased secretion of cortisol, B. Increased secretion of aldosterone and cortisol, C. Decreased secretion of cortisol, and D. Decreased secretion of aldosterone and cortisol. And the answer is decreased secretion of aldosterone and cortisol.
So question number 2. The nurse is planning care for a 52-years-old male client in the acute Addisonian crisis. Which nursing diagnosis should receive the highest priority? 1. Risk for infection. 2. Decreased cardiac output. 3. Impaired physical mobility. 4. Imbalanced nutrition, less than body requirements. I will leave you guys to answer this. The answer to number 2 is decreased cardiac output. This is because when a patient has decreased cardiac output, he or she becomes tachycardiac and hypotensive and may develop shock, which is life-threatening.
Number 3 question says, characteristics of the disease are the following except 1. Chronic worsening fatigue, 2. Purpose stripe, 3. Loss of appetite, and 4. Hyperpigmentation. And the answer is purpose stripe. Number 4 question says, which of the following patient is most at risk for developing Addisonian crisis? A patient who is post-operation day 2 from thyroid surgery. B, a patient who is post-operation day 2 from an adrenalectomy. C, a patient with Addison disease who reports taking prednisone regularly. And D, a patient who is having gastrointestinal surgery. And the answer is B, a patient who is post-operation day 2 from an adrenalectomy. This is because patient who had the removal of their adrenal glands, which is the adrenalectomy, are most at risk for low levels of cortisol since the glands that produces the hormones has been removed. This brings us to the end of this segment. Join us same time next week for another interesting topic. Thank you for watching. Bye.